In this video, we're going to talk about the scapulothoracic joint, also known as the scapulocostal joint. It is a false joint, and in my opinion, it actually does more to add to confusion than it does to add clarity. So we'll talk a little bit about it, and then how we can go beyond the scapulocostal joint and simply talk about the two joints, which are the acromioclavicular joint and the sternoclavicular joint. So the scapulocostal joint or scapulothoracic joint is defined as the anterior surface of the scapula relative to the rib cage. Then they will describe motions of the scapulothoracic joint as the scapula moving relative to the rib cage. The motions you'll usually see listed are elevation and depression, retraction, protraction, and upward rotation and downward rotation. You also see elevation and depression listed as linear motions, retraction and protraction as linear motions, and then upward rotation and downward rotation as rotational motions. Now, upward rotation and downward rotation are indeed rotational motions. They can occur at the AC and SC joints. But retraction and protraction are not linear motions at all. The scapula moves kind of linearly relative to the rib cage, but even if you look at it move here or look at it from a transverse plane view, you can see there's still some rotation involved. And in reality, that motion is actually protraction and retraction at the sternoclavicular joints, and then the scapula goes along for the ride. So this is protraction at the SC joint, retraction at the SC joint. So it's really motion of the clavicle relative to the sternum, and with motion of the clavicle, the scapula goes along for the ride. And this is indeed a rotational motion. So the motions are along a vertical axis. You can see that there, vertical axis in the transverse plane, resulting in the scapula moving away from the spine during protraction, back towards the spine with retraction. But those are actually rotational motions in the transverse plane at the sternoclavicular joints. Also, the elevation and depression. If I really did linear elevation and depression, it would be a combination of downward rotation at the AC joint and elevation of the clavicle at the SC joint for elevation of the scapula at the thoracic joint, if it were a true linear motion. And for depression of the scapula at the scapulothoracic joint would actually be upward rotation of the scapula at the AC and depression of the clavicle at the SC. And I'm not sure that we would see those combinations of motions in any real life motion. So there really is no linear elevation or depression of the scapula. What we do have are elevation of this clavicle at the SC, which brings the scapula with it into an upward orientation, and depression of the clavicle at the SC, which brings the scapula back down. And we also have upward rotation of the scapula at the AC and downward rotation of the scapula at the AC. And in reality, we would actually see the elevation of the clavicle at the SC joint and upward rotation of the scapula at the AC joint together. It looks something like that. So upward rotation of the AC, elevation of the SC, and then we could also have a combination of depression of the clavicle at the SC and downward rotation of the scapula at the AC. But you can see this upward motion or combination of motions and this downward combination of motions looks quite different than these textbook linear motions that we often see in books.